All right. Here is the patient and here is the question. Right. So if you've read and understood, kindly begin your station.
Okay, ma'am. Can I have just few more 30 seconds? Like I will have 9 minutes for that, right? So just few words.
Okay.
Okay.
You'll get 9 minutes to prepare in preparation days, and then bell
Yeah,
will
ma'am.
go, and then
Just few more. Yeah.
yes, please.
Okay, ma'am. I am ready.
All right. Okay. Now, all right. If you've read and understood, kindly begin your station.
Hello, I'm Dr. Abhishek, one of the surgical candidates here today. I'm working for Mr. Mann in X Hospital, and I am just calling to talk to Mr. David, who is the consultant call to seek an advice for a patient. Please check that I am talking to Mr. Mann. Mr. David?
Yes, Mr. David. Who is the consultant of this case?
Mr. Mann is the consultant of this case. Do you have a minute, sir?
Yes, all right. Could you please summarize your case, doctor?
Ask for the
Yeah,
number
sir.
first.
Actually, a 69 years old lady who was previously fit and well was admitted in our hospital as a diagnosed case of sickle tumor with suspected liver metastasis, and she underwent right hemicolectomy yesterday. And now actually she is having, clinically she is having persistent tachycardia, hypotension, and temperature with normal temperature. And on doing some investigation, the recent investigations shows that her hemoglobin dropped from 12 to 10, and here she received 2 units of blood during surgery. Creatinine and urea level is normal, and urea is borderline high. His her ECG normal, chest X-ray clear, abdomen is soft examination, and actually the fact is, sir, last 8 hours, the urine output is 10 to 20 ml per hour. And I have also checked the fluid. She has only got 1100 ml of normal saline post-operatively. And I have also checked the catheter, sir. It is not blocked, that is working really. And I am just calling to seek an advice for this patient at this moment, sir.
All right, doctor, could you tell me what it would be?
I think for this patient, the most common cause maybe the patient is dehydrated, got less amount of fluid in the first post-operative, or maybe that patient is having some kind of internal bleeding, like the hemoglobin has already been decreased. That's why, sir.
Has the patient received any blood transfusion during the operation?
Yes, sir. The patient received 2 units of whole blood during surgery, sir.
All right. What is your plan of action now?
Sir, according to this scenario, I would like to manage this patient according to the CRISP protocol, sir. At first, I would like to check the airway of this patient, and I'd like to give her high flow oxygen with non-rebreathable oxygen reservoir mask. And after that, I'll attach her to continuous hemodynamic monitoring symmetry. Then I will, then after stabilizing adequate breathing status, I would like to quickly, I will focus on the circulatory status as the patient is having hypotension and tachycardia. So I will start right bore IV cannulation, and through one IV cannulation, I will start immediate fluid challenge, sir. And I'll monitor the response to fluid channel for this lady, sir. And after that, I'll send like 2 to 3 units of whole blood if it is if it may be required later on, if it is not manageable with this IV. But I will just closely monitor this patient, and if the patient is not responsive to the fluid resuscitation, I would like to manage this patient in the HDU setup. I would like to do a CV line and also do the fluid resuscitation further, sir.
Do you think the patient is bleeding?
The patient may be bleeding, sir, but right now the abdomen is soft and lax. There is no cyanosis. For this patient, I will do repeated abdominal examination, and if so that I can be able to know if the patient is bleeding, then I would be able to call you, sir.
Do you think the patient might have an anastomotic leak?
Yeah, sir, that may be happened. But right now, as the abdomen is soft and non-tender, so I think there is no anastomotic leakage right now. I'll do repeated abdominal examination, and if possible, I would like to arrange a abdominal ultrasound for that, if there is any collection is present in the abdomen or not. If it is present, I will, sir, let you know immediately, sir.
What if the beds are full? In that case, what are you going to do?
Yeah, HDU beds are full, sir. In that case, I would like to monitor this patient half hourly to 1 hourly until the bed is available, sir, by checking all the vital status like pulse, blood pressure, oxygen saturation, urine output, mental status, peripheral warmth, everything, sir.
What could be the cause of shock in this patient?
I think in this patient, the first cause of shock may be, sir, due to dehydration. That may be a hypovolemic shock, and or maybe it is due to hemorrhage in the abdomen. Into any kind of intra-abdominal bleeding, so that may be a hemorrhagic shock. That may lead to hypovolemic shock also, sir. These two types of shock I would suspect, sir, as the temperature level is normal and all the other safety parameters are normal, sir.
So you said you'll give a fluid challenge for the patient. Could you please tell me the dose of the fluid challenge?
Sir, I would like to give quickly 250 to 500 ml of fluid over 15 to 30 minutes, and I'd like to check the response by checking the urine output of this patient.
All right. Okay, then, doctor. All right, then you could summarize for me the case perhaps now?
Yeah, sir. I'd like to do that, sir. I would like to summarize what we have been through during this time me. So I have got a lady who is 69 years old, who is previously fetal, who underwent right hemicolectomy yesterday for fecal tumor with suspected metastasis, and today suddenly he has developed persistent tachycardia, hypotension, and with normal temperature. And have investigations, the hemoglobin dropped from 12 to 10, and everywhere like creatinine, urea, ECG, chest X-ray, normal, abdomen is soft. The main problem is patient urine output over first 8 hours. So according to your advice, I would like to manage this patient to the CRISP protocol. After checking the airway, giving adequate oxygen, I would like to quickly focus on circulatory start IV fluid resuscitation by giving fluid channels challenge first, and monitor the response to that. If the patient is not responsive to fluid channel, at least 2 fluid channels, I would like to refer the patient to the HDU to do a CV line and further resuscitation. And I would like to send further investigations for this patient. And right now, I'm not suspecting any kind of intra-abdominal bleeding or any kind of peritonitis, as the abdomen is soft and non-tender. I would repeatedly do the clinical examination, abdominal examination, and if possible, I like to arrange a ultrasonogram for this patient, and I will let you know, sir. And I would like to monitor the patient until I can send the patient to HTU, right, sir?
All right, doctor, you can transfer the patient then.
Thank you so much, sir. Thank you for your time, sir. Thank you for your.
Thank you. So did you mention in the beginning acute kidney injury? Because urea creatinine are little raised. Yeah, that we
Creatinine is
forgot.
not raised, ma'am.
Creatinine,
creatinine is not raised, ma'am.
Little, within normal, but little to the
within normal level.
Yeah.
That's why I didn't remember.
Yeah, but then it could be acute kidney injury because patient is post-op and dehydrated, most likely. So this could be,
as it is within normal range, ma'am. That's why I didn't focus
normal,
on that.
but then still, you can say most likely
like borderline high,
secondary
right?
to dehydration. Yes.
Secondary to dehydration. Okay, ma'am.
Right, and then there was one question. Your doc consultant should have asked you that do you need me to come and see?
Oh yes.
Okay, right.
Yeah,
consultants
before
need not to come.
Yeah. Then you would have told no. I will call you again and I will update you after I've given the fluid challenge. So
yes, ma'am.
Okay.
And even you'll send the bloods. You'll repeat the blood test as well.
Yes,
and if they turn out to be worsened, then you will proceed with CTPA, and then you will definitely contact. So then CTPA, and then you'll give the TED stalking, and then anticoagulant.
And also mention that you are going to check the drug chart, and if there is any nephrotoxic drug that the patient is perhaps getting, you'll stop that. You'll then you'll flushing of the catheter to check that there is no kinking.
I have already checked that. I guess that's why I didn't mention.
Yes, you said. Yeah. And then you mentioned that, and then you mentioned the chart, intake output chart. Then okay. And if everything fails, then you would also think about dialysis.
Yes, in advanced stage, yes, that can also be, good. And the one thing is, I was fearing maybe he'll say, I have already told you this. He didn't say that. So
no, he didn't. He's doing very good. Dr. Abhishek was really well.
No, ma'am, I just want to know one thing. Whenever I perform something like you, I need you to tell me it is possible or not, ma'am. Please just say
it is. That's good.
Yes, ma'am.
But
Thank
we're
you so
practicing.
much.
If one or two things you forget,
no, I want criticism. Trust me, ma'am. I want criticism. Really great, ma'am. I always
but
want
within the range, criticism within the range. We cannot go out of the range to give you because I
am always inspired by criticism. Trust me.
We give feedback. This is not criticism. It's just the feedback, because anyone can
it's
make
like
mistakes.
constructive
Sometimes I don't
criticism.
hear
That's
as well.
it.
Sometimes your people are telling me, I'm asking and I'm not. I miss the word. I don't hear it. Or I at the end say I didn't hear and you tell me no, a person said it. So that can also happen. But then okay, I wasn't sure if you mentioned acute kidney injury, so that I.
No, I didn't, because as it was normal, that's why I didn't mention.
Yeah, so that maybe we can, because patient is post-op and there is oliguria, so most likely
we know several causes, right, ma'am?
Yes.
Like post-operative oliguria may happen physiologically.
This is the most likely post-op complication that can occur. So that's fine.
Yes, ma'am.
Okay.
Very good, excellent. That's how we will keep on going. So third one, anyone interested in a surprise station? Thank you, Dr. Kulpat, and thank you, Dr. Abhishek. Yes, anyone interested